All right, I'm Kevin Libuit, joined by Andrew Page. We're from Fusion, and this is the Bioinformatics Lab podcast. And this week, we're going to kind of continue the conversation in discussing public health bioinformatics. I think something interesting perspective you and I can both bring to this are the regional differences, at least in our experiences in public health, and how this approach of implementing bioinformatics has been performed in maybe the US versus the UK, and then even our understanding of some of the global perspective in large consortiums like phage and GMI and the like. And I can kind of start on my end from the US perspective. As I talked about last week, my experience started at the Virginia State Public Health Sciences, and this was Public Health Laboratory, and this was in 2016. So this was kind of a unique time in the U.S. Pathogen genomics lore, as it were, in that this was, I think, maybe this first year, within the first year, maybe second, where public health laboratories were transitioning from traditional techniques like PFGE into whole genome sequencing, and at the state data. Virginia was one of them. So there was no bioinformatics at the state level because they weren't generating the data until this year. So I actually got brought on as the first bioinformatics scientist in the state of Virginia. And I was one
Really?
of only, yeah, it was an interesting
Wow,
time. So
that's impressive.
it was an incredible luck of the draw in the timing of my career, because you're in the academic space, you're just so drawn into what's happening in the pathogen genomics, you're not really quite sure where the career is going. I didn't even really know much about public health until my PI got tagged by the Virginia State Public Health Lab, and then he started learning, oh, they're starting to implement this technology. And Virginia went so far as they put a data internship program under Governor McAuliffe in that year of trying to attract academic talent to help them make sense of these types of data. And so that's how I got brought into Virginia. It was like, hey, we're generating this innovative data. We need to make sense of it. No state really has the capabilities. We certainly don't. Let's try to bring in somebody fresh from academia in who can kind of give perspective. And that was my intro into public health. So I have always had that luxury of the front row seat of watching what bioinformatics implementation looks like for public health laboratories. And as I mentioned, I was in Virginia, and I think at that time I was one of only four other state level bioinformatics scientists. So Joel Savinsky was one at Colorado, Kelly Okeson in Utah, and Sean Wang in Minnesota. And there was, in the US, we have the federal government that everyone knows, the CDC, FDA, USDA. But then, we are a United States, and that their states have their own local governments that have their own challenges in implementing technology, from IT to infrastructure to workforce and all the like. So when we had challenges of bioinformatics implementation at the state level, it wasn't always obvious how the CDC could support us because we were so state specific. So the CDC didn't necessarily face the same challenges we did in Virginia. But what was actually really interesting is that when I found out about Joel and Kelly and Sean, the CDC, Heather Carlton, actually put us all in contact. We realized that our challenges were more alike as states relative to federal challenges. So the progression across the US in terms of harmonizing on best practices and figuring out what to do in terms of bioinformatics implementation at the state level started with the four of us communicating and figuring out, hey, what's happening in Utah? Let me tell you what's happening in Virginia. What are the challenges you're facing? What kind of tool are you building, etc. And we started this consortium, State Public Health Bioinformatics, and this was StaPH-B. And this started with the four of
Oh,
us.
okay.
Yes.
I didn't know that's what it meant. I thought it was like Steph Warriors or something like that.
We're aware of the implications of using staff there for sure. That we throw the hard B for the bioinformatics. So yeah, and that was something that we the community building. I'm always about the community building, and it made such a big difference that you weren't going it alone. That you knew you were starting to build tools. That if I was going to build a tool, I wanted to make sure that Kelly could use it. And then I was also looking at the tools Kelly was building, figuring out how can I use that in Virginia. So we didn't have to reinvent the wheel. Again, the sort of focus in public health is not necessarily innovating, doing something uniquely different and novel. It's rather, here's a best practice. We're watching it work in Utah. We know it's going to be useful in Virginia. How do I just implement it over there? So that was, my role throughout my time in Virginia was watching this community build up and disseminate best practices. And I think from that community is how across many US states, we're able to proliferate ideas really quickly. Because then
So
from,
tell me,
yeah,
how does the FDA fit into all of this? Because you got CDC and then you have the FDA who do sequencing, and I think the USDA do a bit of sequencing as well. So how does that all fit together?
the FDA has a program called Genome Tracker, where it's more the I guess you would probably categorize it as the One Health perspective. Whereas, there is clinical samples as well, but there's also like agricultural sequencing, food sample sequencing, and all the like. So that's Genome Tracker, where it's general surveillance of foodborne pathogens. And that was actually, I think, I don't know if it was the main funding, but that was a lot of the funding too in Virginia of how sequencing started. And obviously, there's a lot of overlap with that and things like PulseNet and the focus on foodborne pathogens. But that was always my interaction with FDA and sequencing efforts. And from that, there stems a lot of different initiatives in terms of like AMR surveillance in agricultural settings. That's obviously a huge priority for the FDA. Whereas I always saw PulseNet and foodborne pathogens from like EDLB, infectious disease laboratory branch, of more on the clinical outbreak investigation side of things, of like when things are happening on there. So complementary efforts for sure, but somewhat distinct in their insight. But all that to say, FDA was also one of the first programs at the federal level to implement sequencing for pathogen genomic surveillance.
I know here in the UK, it's complicated as well,
Yeah,
because the UK is four nations when it comes to public health. So you got Scotland, England, Wales, and Northern Ireland. And yeah, so it's a devolved power. So it's like states, like there's some powers and then there's some federal powers. So it means that everyone does it differently.
yeah,
And also England is a very large population, so they are kind of the heavyweights in the corner. So Wales is very good. They have like a super integrated system for doing public health bioinformatics and surveillance. And it's all really well connected. We've a National Health Service here, so everyone has a number and everything is connected. All the data is all joined up. And in Scotland, similarly as well, they work very closely with academia as well, and they've joint appointments similar to Wales, and they do things very closely as well. Then England, I guess more people, more funding. They do things slightly differently, and I guess it's not as joined up, but they do have aspirations for joining it up a lot more. And then Northern Ireland is, I guess, a little bit out there slightly because small population, 1.5 million people, and so they don't necessarily have the full resources to do everything themselves. So some stuff gets outsourced to the UK or jointly with the Republic of Ireland. So slightly different ways of doing things. But one thing that they have in common with the United States is that the openness in sharing data
yeah.
and getting data out there, like particularly raw sequence data. Now, not the like the metadata. Obviously, there's procedures to go through to get all of that. But in terms of sequencing data, at least getting it out there. So if you're actually to look at say the SRA or whatever, you'll see that Colindale in London is just this hotspot of disease, and that's because everything is just coded to, the Public Health England does, or UKHSA does, is coded to their main lab rather than anything else. So you have to go to them and ask them for the data and have a legit excuse. But that's a good thing. But a lot of countries don't share data, or they will only release information or release samples when they publish, and they don't publish everything. So, which is quite worrying, because a lot of taxpayers' money in other countries is going to producing sequencing data. It's all being kind of hidden away within their state or within the country itself, not even necessarily shared, say if you take Europe as an example, they're not even shared at a European level, which is less than ideal. I know there's different laws in different countries, but surely a cultural isolate, that gets sequenced should be shared publicly.
Yeah.
I mean, it's not, there's no human in there. There's no, if you don't release any other data, it should be straightforward enough. Other countries like the US and UK can do it. So why not? And actually, if you then go and look at the the volume of data going out. Like, was it salmonella? There's 300,000 or 400,000 salmonella isolates out there, publicly sequenced. Virtually all of them seem to come from the US, to be honest. Um, and obviously UK does a fair work as well. But then other countries, it's pittance. For a long time, actually, during the pandemic, Denmark had sequenced and publicly released more genomes than all other EU member states combined. Like, it's not a big country either.
Yeah.
Small little country, more than all the rest combined. And that's because they had gotten their act together, to change legislation or interpret rules differently to release data. And that's my pet peeve. Sorry.
No, there's two thoughts that come to mind whenever you were saying that. One, I guess sometimes I don't, because I came into the world in this practice of sharing data. I don't sometimes maybe highlight the credit deserved to PulseNet and even Genome Tracker in the US, where it was always a part of the funding. If you're going to sequence something, you have to get this up into NCBI or SRA or GenBank in some cases. So it was always a part of the practice of, and even further so, like in PulseNet, they had mechanisms for data sharing. They tried to make it as easy as possible, because that could be often the barrier, is how do you interact with the NCBI interface to deposit to the right database, make sure metadata is categorized in exactly the right way, from biosamples, from SRA IDs, and all the like, that can often be a bit intimidating. On PulseNet, they made it easy. They even integrated it into the software, I think in Bioinformatics, where you can take your data from base space, you have your sample sheets and metadata already, and from a couple of click buttons away, you made it they made it easy for laboratories to share the data. So hats off, as I said, to the PulseNet folks for that prudent planning. Something that, again, I only realized the uniqueness in learning more about how other laboratories are approaching this across different jurisdictions.
Yeah, I mean, like in Europe, when I say Europe, I mean the European Union,
Yes.
of which I'm a citizen. I am a citizen of the country, of the state, or not state, of the organization I'm criticizing. But like the courts only recently decided that, like, say, a pseudonymous identifier that you have in a sample
Yeah.
is not private data. It can actually be publicly released, and that's a big thing, because people are saying, oh no, the sample ID, that could get back to a person, or it could get back to a factory, so you cannot release it. But now they've actually clarified, no, you can. And so that releases one more hurdle to hopefully get a little bit further down the food chain. But then the complexities of law in different countries. In Europe, each country or each state has its own set of national laws, and then you have overall Europe has different levels of laws. Effectively, some are just gentle nudge in the right direction. Some are, we'd like you to do this, but if you don't, we're not too bothered. And then others are, you must do this now or we'll fine you, and change your national laws. And so, it's very complex and it's slow moving, because you have so many different countries, 27 different countries potentially having to change their laws, for stuff. So it moves at its own pace, and that can slow things down. And people interpret laws differently, particularly around data release and openness. This has led to a huge amount of investment in systems within Europe to, I guess, release what they can, but try and not give too much, or to allow checks and balances, or to change it so that they can share data with some people but not other people. It's more restrictive. And actually, to be honest, if they use all that money to do something else, it'd be a lot better, because they could just release all the data publicly and it would have no difference. Well, actually, it would have a positive benefit, and it just pains me to think about all that data, probably hundreds of thousands of samples sitting there, or millions of samples sitting there in countries not being released. And they could be the key to solve an outbreak, or to spot the next big thing. Or a lot of outbreaks aren't necessarily, this big bang, it infects 50 people and, in a week, they could be the slow running, ticking over, and, causing issues, as time goes on. I think I think it was maybe Netherlands. Before they brought in genome sequencing, they basically solved no listeria outbreaks whatsoever. It was they had they have a few hundred listeria cases a year. Zero could be linked together, were solved. But then they brought in genome sequencing, and then suddenly they started seeing, oh, this is
Yeah.
these are all linked together, and these are common sources, and they could actually start putting the puzzle together. And it's that power, but when you have all the data out there, publicly available, cross-border, availability, that really means that you can drill down into that. How do you remember that the well-traveled salad?
I feel like it's brought up at most slide
Uh,
decks. Yeah, I love seeing that at foodborne conferences.
yeah, exactly. You could have like your standard salad could have ingredients from 10 different countries in it.
Yeah.
And you try working out which one caused the issue. It's hard. Source attribution is very hard.
And that being a big part of it is data sharing. One thing I wanted to get back to that maybe this is specific to the UK. You talked about, okay, there's the different country jurisdictions, but then on the sequencing and the bioinformatics side, are those centralized by the countries themselves, or is it distributed beyond that to localities in the way that I'm kind of describing the US, where it gets distributed across 50 different states, and then there's even localities beyond that at the local level?
In the smaller countries, it's more centralized. In England, it's very decentralized. Um, and then even further still, like if it's kind of researchy, then it goes into university or research institute. So it basically depends, and it's
Yeah.
basically down to the size of the data involved.
Is there a StaPH-B analog across UK where it's like, all right, we're the public health people who are all communicating with one another, trying to figure out the best practices? Like, as countries of the UK, we have very unique challenges, and we all kind of want to be on the same page of implementation.
There might be, but the closest thing I can think of would be the Arctic Network, which is a charity-funded
Yeah,
um, network of different, I guess, academics and public health. And that is quite interesting because they're the guys who came up with the primers
yeah,
for SARS-CoV-2. But the Arctic Network is as shorthand we call them the Arctic primers, but actually they've done similar things for Zika and the like, and they're I came out of the Ebola outbreaks in West Africa a few years ago. So it's a resource there that does bring together lots of different expertise and can be deployed at short notice. With people who are super expert, academics are super expert in very particular areas. But there's nothing like StaPH-B that I know of. Although the funders these days in the UK, they're all about their networks, research networks. They really
yeah,
like giving money to try and bring people together, which it's a reasonable thing, and hopefully you can get better bang for your buck.
yeah.
Then the EU goes the complete opposite, where it is super over networked, and they will spend many, many years talking about it and not getting very far.
It's amazing how organic it was for StaPH-B to roll in just out of the necessity, because we were all kind of in our own little boxes trying to figure this thing out. Yeah, so maybe there is room for any of the public health people across the UK to start that kind of consortium, and maybe there could be collaborations in terms of how we've developed things in StaPH-B, and because StaPH-B isn't only now, it's more than just a forum of communication. Like, there's proper projects that come out of StaPH-B, like the StaPH-B Docker builds came out of a couple people across StaPH-B recognizing the utility of containers and recognizing, hey, obviously biocontainers exist, but there's also, again, the difference between academic resources and public health resources, and that's where the StaPH-B Docker repository kind of came about.
I guess I give a shout out to Galaxy EU
Mm.
because they're based in Freiburg in Germany, and they're kind of doing something like that. They're doing a lot of resources and training in Galaxy for the wider community. Anyway, I think we should leave it there.
Yeah, yeah, yeah. Again, a topic we can continue rambling on about for a while. We didn't even get to the global perspective, but we'll save that for another episode in the future.